Hi, my name's Chris Floriel. I am a Maryville nurse practitioner student, and I'm going to be doing a head, eyes, nose, and throat assessment today. Good afternoon. My name's Chris Floriel. I'll be assessing you today. What brings you in?
I've been having some sinus issues and drainage and headaches.
Oh, okay. Well, I'm going to do a head, eyes, ears, nose, and throat assessment on you. Okay, so the first thing I'm going to do is just kind of look and see what your hair looks like, see if I see any kind of missing hair, what if there's any abnormalities in your scalp, any rashes or dermatous abrasions or anything like that. I'm looking to see if it's symmetrical. Then I'm going to look at your eyes, and I'm looking into your eyes to see how clear your sclera is, how your conjunctiva is, seeing if there's any drainage, seeing if I see any objects in your eyes, what color, if they're symmetrical in color, and they all look good. I'm looking at your eyebrows to make sure that there's no crustaceans or no any kind of abnormalities about those. Those look good. Your nose is nice and midline, looks centered, and I don't see any drainage or redness or rashness. And then I'm going to look at your mouth, make sure that your mucosa is moist, that your lips aren't chapped, and then I'm looking down at your throat and your neck area to see if I see any abrasions, any papules, any kind of abnormalities like that. And it all looks good. All right. So next thing I'm going to do is just palpate some stuff. Tell me if you feel any tenderness. Okay. All seems pretty good. Very good. All right, next thing I'm going to do is just kind of feel for your lymph nodes, okay? So I'm going to go post-auricular, and then your pre-auricular, your tonsillary, your submandible, your submental, and then your post-cervical, and your pre-cervical, and then your clavicles. Any tenderness, anything like that?
No.
They all feel really good there. Okay. Next thing I'm going to do is check out your thyroid just to make sure everything works good, and your trachea, and it looks midline and it moves well. Go ahead and swallow for me. Very good. Okay, great. All right. Next thing I'm going to do is grab a pen light, and I'm going to just check your eyes out for me. If you could take your glasses off. All right, so going to be a light, and it's just going to shine. I'm just basically checking to see if you have, yeah, good constriction, good, very good. Okay, now I'm going to check your cranial nerves 3, 4, and 6. If you could just look over here at the pen light, and then follow it with your eyes and not with your head, okay? Side. Keep your head still. All right. Very good. Follow it in here. All right. Next thing I'm going to do is check confrontation. So I want you to tell me when you can see my hands in your periphery. Keep your head straight. Okay. Tell me when you see my hands.
Now.
Okay. Again.
Now.
Okay. Very good. All checks out really well. All right. Next thing I'm going to do is check your eyes out. So I'm going to be basically looking into your eyes with my otoscope, and it shouldn't bother you. So I'm going to go your left eye to my left eye, and then if you could just look forward, you'll see a little light. And what I'm looking for right now is the red reflex. Moving it on the red reflex, I'm looking your cornea, and visualize the vascularization, and everything looks good in there. Very good, nice pretty eyes.
Well, thank you.
Yeah, on the other side, right here. Okay, I see the red reflex, and I'm moving in, taking a look. Visualize the macular densa in the cornea, and it looks great. Everything looks good in there. All right, next thing we're going to do is just check your vision. So you can put your glasses back on.
Okay. I won't see without.
Yeah. You're going to hold this about 14 inches away and cover your left eye. And you're going to read the last row that you can read.
LTFPH.
Okay, that's 2020. Go ahead and cover your right eye and tell me the last row that you can read.
LTFPH.
Okay, good. That's the Snellen chart. Now we're going to do the Rosenbaum. Same thing. Cover your left eye. Tell me what's the last one you can read.
428385.
Okay, and then you cover your right eye and do the same thing.
374258.
Ah,
That was better.
yeah, feels a little better. So, 2020 and 2030. 2030 in your right eye, so that's a little better, or a little worse on your one side. Okay, so the next thing we're going to do is we're going to take a look at your ears and nose. Now, before I do that, there's a couple things I just wanted to check out. So I'm going to check your temporal artery, and I'm going to check your carotid arteries, all right? So the first thing I'm going to do is just palpate your temporal artery. I'm using my pads and my fingers, and I don't feel a frill or anything. Everything feels good. Your carotid. Okay. Yep. All right, now I'm just going to listen. All right, no thrill or worry. Very good. Yep. Very good. Nice and strong. Good regular rhythm of your heart. Okay, very good. And then next thing I want to do is I just want to go ahead and I want to check out a couple of things. If you could open your mouth for me. All right. Your dentation looks great. Nice and pink and moist in there. Your lips look good. Just stick your tongue out for me. Very good. And then I'm going to say, have you say ah? Good. Tonsils are nice and small. Oh, uvula is good. Hard and soft palate looks good. And your dentation looks good. All right. Do me a favor and just open and close your mouth for me. What we're doing is we're texting. Oh, you have a little click there.
Uh-huh.
Did you know that?
Yes, I did.
Okay, yeah, you have a little click. That actually indicates that you have a little TMJ, your TMJ. So have you had that checked out before?
Yes, I have. My dentist just looking at it.
Okay, yeah, well, we found something,
Yes,
didn't we?
we did. We did.
All right, next thing we're going to do is we're just going to take a quick look at your nose, make sure it's patent and how everything looks in there. So if you could just tilt your head back for me real quick. Just a little bit of tension right here. Nice and good. And patent, nice and pink. Other side. Nice and pink and patent, very good. All right. And now I'm going to check your ears. So the first thing I'm going to do is trip over my shoelace and then I'll pull up on your peanut. Any pain with that?
No.
When I do that? Okay. So I'm going to visualize the light reflex and the temporal canal and see everything looks nice and clean and like a paler yellow. No secret or anything noted in there. All right, same thing over here. Any pain when I pull?
No.
Okay. All right, same thing over here. And everything looks good and clear in there. All right. Now we're going to do a couple of hearing tests. And the first test we're going to do is called the Weber test. So I'm going to strike this. I'm going to put it on the top of your head, and I want you to tell me if you hear it in one ear or the other ear or by both ears.
I think that one.
Do you hear mostly in both ears though?
Mostly in both ears.
Okay,
but-
good. That's what we want. All right. Next thing we're going to do is called a rhyme test. And what's going to happen is I'm going to strike it. I'm going to put it on your bone behind your ear, and you're going to hear it. And then when you stop hearing it, I want you to tell me, and then I'm going to place it right next to your ear, and I want you to tell me when you stop hearing it when I place it next to your ear.
Okay. I'm not hearing it.
You're not? Let's try that again.
Okay.
Stop.
Stop. Stop.
Okay. So your AC was a little longer than your BC, which is what we want.
Mm-hmm.
Okay. And then we're going to do the other side.
Stop.
Still going?
Mm-hmm.
Wow.
Stop.
Well, your right ear is lasted a lot longer than your left ear. You have better hearing in your right?
I guess I do.
Yeah. Go ahead and occlude your left ear for me, and what we're going to do now is the whisper test.
Okay.
So I'm going to say a word, and I just want you to repeat it to me.
Okay. Baseball. Baseball.
Okay. Close your other ear, and we're going to do the same thing over here.
Basketball.
Very good. Okay, so we checked your head, we checked your eyes, we checked your eyebrows, we checked your nose, we checked in your mouth, and we checked your ears. Is there any complaints about your throat or anything like that? We checked your carotid arteries, your thyroid, and that your throat was midline and everything looked good.
Just a little sinus drainage, that's all.
Okay. Well, thank you. That concludes my assessment for you today.
Well, thank you.